At Meridian, our quality department provides updates to staff via emails, newsletters, and all sorts of meetings, as I'm sure your organization does as well. We call our communication segments Quality Matters, because after all, quality matters in everything we do. For the next few moments, I'd like to share with you what we call our burning platform for improvement. You know what a burning platform is, right? It's that decision point where the platform you're standing on is on fire, and it makes more sense to take that chance of jumping off the platform than to remain where you are. What's the burning platform for us? It's a changing landscape of our healthcare system. We've listed a few of the changes that we're experiencing, and I'm sure you could name plenty more. I'm going to talk briefly about each one of these changes in just a moment. But first, raise your hand if you love change. That's what I thought. I'm sure you're all well aware that the United States ranks #1 in the use of opioid prescriptions. In fact, our nation's leaders have declared it to be a national crisis. According to the CDC, on average, 130 Americans die every day from an opioid overdose. The state of Indiana, my home state, has the 5th highest opioid abuse rate in the country. In 2017, Meridian opened its first adult rehabilitation facility. In 2018, we opened our second, and we're now exploring the possibility of our third. We're using our continuous improvement philosophy to manage, monitor, and respond to this global epidemic. Let's talk about the patient experience. As a result of one of our projects, we've implemented a new, more accurate system for capturing patient satisfaction scores, and we've made individual office and provider scores transparent across the system. In addition, we've created additional education and training for all of our staff. By creating transparency, we've been able to achieve a 95% satisfaction rating amongst our behavioral health patients, and our provider satisfaction scores are at 99%. One of the outcomes of our continuous improvement model has been the creation of steering teams for all of our service lines. These teams track and monitor outcomes, including our patient satisfaction scores. A big challenge facing healthcare right now is the evolution of technology. I'd like to tell you that we're keeping up, but we're not. However, what we've been able to accomplish is quite impressive. We've brought telepsychiatry into rural areas so our patients will have access to psychiatrists. Another project we're rolling out is the use of technology to complete psychiatric assessments in rural hospitals. This will reduce the need for our licensed clinical social workers to have to travel to hospitals, which interrupts patient care during the day and family time during the night. One of the outcomes we expect to see from this project is an overall improvement in staff satisfaction and retention. We've also completed a project which introduced a web-based service to track and monitor behavioral health patient progress and satisfaction. This has also served to improve and enhance clinical supervision time. For a long time, the outpatient world has been able to enjoy the benefits of a fee-for-service model, but this is changing. Both payers and patients are wanting to see a demonstration of quality. Meridian's response has been to implement a robust methodology for tracking outcomes and making improvements, utilizing a methodology we call Focus PDCA, which we'll talk more about in just a moment. Every healthcare organization has regulations, surveys, and audits. As an integrated healthcare system, we have multiple every year. In fact, we've had 4 in the last 30 days. Most of the time, we do great, but there are times when we must implement a corrective action plan. Our quality department oversees these action plans, which sometimes result in the chartering of a project that must be managed and sustained. Understanding the root cause as to why something isn't working right and implementing sustainable solutions is the key to eliminating defects. At Meridian, we pride ourselves on our integrated healthcare system. We started out as a behavioral health organization, but in 2010, we added primary care to focus on whole person health, and we've continued to grow. In addition to primary care, we've added pediatrics, women's health, inpatient substance abuse, maternal addictions treatment program, and most recently, dentistry. All this is in addition to our therapy programs, case management, inpatient psych units, group homes, HIV services, foster care, and our Connections program, which focuses on the duly diagnosed, just to name a few. Managing transitions between these cares, assisting with the creation of solutions for whole person health, have also become a function of our performance improvement team. We utilize continuous improvement to support the ongoing functions of a continuum of care across our system. And finally, how do we do more with less? At Meridian, we like to think smarter, not harder. We're all facing shortages, and how do we respond? We have to do things differently than the way we've always done them before. After all, what's the definition of insanity? It's doing things the same way and expecting different results. There are lots of great PI programs available. What I'm going to share with you is a program that has enhanced our success. It's a simple plan that anyone can implement and see immediate results. You've heard the old adage, fail to plan, plan to fail. Most organizations have found that creating a committee around a problem really doesn't work. Organizations need a way to implement standardization and sustainability. We need to be intentional about solving our problems and moving measures. We need a plan.